Hi, I'm Professor Clare Bambra, Newcastle University, and part of the FUSE membership of the School of Public Health Research. I co-lead HIP, the Health Inequalities Programme in Phase 3, together with Professor Jenny Pope from Lilac and Dr. Rebecca Mead, also from Lilac. We'll talk about our programme that's in development for Phase 3 of the school. Through our workshops, we've come up with 3 key areas for attention: levelling up and pandemic recovery, improving methods and tools for health inequalities research, and co-produced research with communities. And we're also engaged in dialogue with the other programmes about potential cross-programme projects. In terms of our work that we're proposing around evaluating the government's levelling up policies and pandemic recovery, I want to start by talking a little bit about the context in terms of trends in health inequalities over the last 2 decades. From 2000 to 2010, under the National Health Inequality Strategy in England, there was a significant decrease in health inequalities between the most deprived local authorities and the rest of England. In this chart, come from School for Public Health Research 2 evidence, we can see, for example, that infant mortality rates the gap significantly declined during this policy period. However, from 2010 to 2020, trends in health inequalities began to reverse. Again, research from School for Public Health Research 2 has demonstrated some of this. Jointly with the Children and Young People's theme, a paper was published evaluating how increases in child poverty have been accompanied by unprecedented increases in infant mortality rates, particularly in the most deprived local authorities. Research joint with the Healthy Places programme has also found that changes in health inequalities have been related, for example, to cuts in local authority spending. So work led by the Places theme by Professor Ben Barr from Lilac found, for example, that with each £100 reduction in local authority funding, there was a decrease in average life expectancy of birth of over a month. These funding reductions were greater in more deprived areas, and so the cuts in funding have been associated with an increase in the gap in life expectancy of over 3%. On top of this, obviously over the last 2 years, we've had the big impact of COVID-19. And in School for Public Health Research 2, we've done a lot of research exploring these inequalities and what they mean for more deprived local authorities, regions and communities. Working with the Northern Health Science Alliance, for example, we've done a lot of work looking at the impact of COVID-19 on the North, finding that deprived local authorities in the North had a much higher mortality rate than equally deprived local authorities in the South. We've also worked with the APPG on left behind neighbourhoods and discovered that mortality rates were even higher in the most left behind, the most significantly deprived neighbourhoods in the country. And working with the Children and Young People's programme in SPHR 2, we've also evaluated the wider impact of the pandemic, for example, on education and learning outcomes, again finding worse outcomes in the North and for more deprived local authorities. We've also set out the idea of a syndemic pandemic, trying to explain why these health inequalities have emerged in COVID-19, thinking through the influence of the social determinants of health and the disproportionate burden of key clinical risk factors amongst most deprived populations and communities. So into this context, the government has launched a big levelling up strategy with the white paper in February. And they've stated that levelling up is a moral, social and economic programme for the whole of government. They have 3 key missions around which include spreading opportunities and improving public services, restoring a sense of community and local pride, and empowering local leaders and communities. They also have a target that by 2030, the gap in healthy life expectancy between the highest and lowest areas will have narrowed, and that healthy life expectancy overall will rise by 5 years. There are various ongoing and forthcoming initiatives that are part of this levelling up strategy, including the Levelling Up Fund, the Community Renewal Fund, the Shared Prosperity Fund, and so on. There's also a levelling up health white paper, which is expected late summer, early autumn. So in our work stream for SPHR 3, we plan to evaluate this multifaceted, holistic levelling up strategy and to see the impact it has on the health and the social determinants of communities across England. We're going to use mixed methods, take a long-term approach, conduct longitudinal, both quantitative and qualitative and economic evaluation, and focus on a multi-scale basis, looking at individual outcomes, neighbourhood, local authorities and regions. We'll also collect data looking at the experiences of diverse communities, coastal, rural, minoritised communities and socially excluded groups. In this way, we'll be drawing across the skills of a diversity of school members, and we'll be able to conduct multiple natural experiments of the various intricate aspects of the levelling up strategy.